We'll quickly look at different levels or different values for plasma glucose. So one thing is, if the values you'll be looking at in this video is the normal values. So you are knowing the normal values because if you now do any test and you find the values being lower than the normal values or being higher than the normal values, that's the abnormal values. You get. So plasma glucose normal and abnormal levels or values. Okay, so plasma glucose just simply have to do with what? Glucose in circulation. All right. So if you are doing a fasting plasma glucose, there are different ways to dictate plasma glucose, right? So fasting could be postprandial, that's after meals. It could be oral tolerance. It could be glycated hemoglobin. So for this one, which is what the fasting one now, the normal levels should be less than 100 milligrams per dl. Normal one should be less than 100 milligrams per dl. Then for impaired fasting glucose, that's pre-diabetes. That's like pre-diabetes, that's before diabetes, right? You see that the levels are between what? 100 to 125 milligrams per dl. Okay, I've already told you guys how to convert milligrams per dl to millimoles per liter. Then for diabetes, that's when you are finding that the fasting plasma glucose is more than what? 126 milligrams per dl. Okay, the postprandial now, that's after a meal. You see that normally after your meal, like after you take a meal, it should be less than 140 milligrams per dl. Impaired glucose tolerance should be about what? 140 to 190 milligrams per dl. Diabetes, that's like if you find out that after a meal your glucose levels are hitting like 200, you know that what? You are diabetic. You get. So for the oral tolerance glucose test, for the normal values for the fasting should be less than 100. For 1 hour should be less than 180 over 180 milligrams per dl. Then 2 hours should be like 140 milligrams per dl. Then for pre-diabetes is when you are hitting high values. Okay, so pre-diabetes, like pre-diabetic patients, if you do a fasting test, you see that it is 100 to 125. 1 hour is 180 to 199. 2 hours is 140 to 199. Okay, then for diabetic patients, you see that when you do their oral glucose tolerance test, it should be more than 126. If you do 1 hour, is what? 200. Then 2 hours too should be 200. Right, then glycated hemoglobin will be there when there is basically what? Too much glucose in circulation. So now some hemoglobins will get combined with what? We get combined with hemoglobin will get combined with glucose, right? So normal levels should be less than 5.7% of your hemoglobin should be combined with glucose. So if you are pre-diabetic, you find out about 5.7 to 6.4% of your hemoglobins are combined with glucose, right? Then diabetes, if you are diabetic, you find out more than 6.5% of your hemoglobins will be combined with glucose, right? So that's it for what? A plasma glucose normal and abnormal levels, or you could say normal and abnormal values.